Hello everyone, my name is Dr. Joshua Daye and I'm the owner of Juvaura Medical Aesthetics and Wellness here at 17 Latham Avenue, Kingston and at 110 Main Street, Ocherius.
And how long have you been a doctor?
Roughly 6 years.
What's your specialization?
Aesthetics and anti-aging medicine as well as general medicine.
Talk to me about this new revolutionary medicine. When did it come to Jamaica and when did you start practicing it?
Roughly in 2021, I was training in Miami. I started with, Botox and fillers and actually fell in love with it and decided to add a wellness component because you want to correct any disease process from the inside out. So I decided to really also focus on wellness, which involves men's and women's health as well.
When did you start treating erectile dysfunction?
So I've been in private practice for about 3 years now, so roughly 2021, around there.
In your 3 years of practice, what are some of the trends that you're seeing in relation to the disease?
So typically for erectile dysfunction, we treat with medication, right? So the Viagra. I'm not sponsored by them, but we typically use Viagra or Cialis. But some conditions, for example, people who have heart disease would be contraindicated because it can cause a drop in the blood pressure if it's not monitored properly. And to be honest, a lot of patients, they're not compliant. I mean, they will be compliant if it involves intercourse, but just the idea of taking medication, some people are not really fond of that. So the PRP, it's natural, it's long-lasting, and it's quite effective. So it actually is addressing the root cause. Sometimes the medications do not address the root cause. So PRP in itself addresses the root cause by repairing any damaged tissue or blood vessels.
You mentioned Cialis. What exactly is that?
Basically, it's a medication that causes vasodilation. So that basically means that the blood vessels open up so that the blood can flow much easily.
In your 3 years of treating this disease, what age group do you tend to see as patients?
Initially, it was up, say, 45 to 65, but now we're seeing younger men coming in as young as 25 years old with erectile dysfunction. And I think, lifestyle choices, alcohol, cigarette smoking, and marijuana smoking are contributing to erectile dysfunction. As I mentioned before, there are many different causes, and we classify them. So you have vascular, which is cardiovascular, diabetes. It can be due to psychological reasons as well. So since COVID, there's an uptick in mental health challenges. So these disorders can also contribute to persons developing erectile dysfunction. Persons are turning to like herbal treatments, some which are damaging their liver, kidney. People are getting drugs off the black market, and sometimes these drugs are contaminated with like fentanyl and other medications. And yeah, it's a serious problem. So it's important that you seek help from a licensed medical professional to avoid some of these consequences.
For platelet-rich plasma treatment, are there any side effects?
Typically no, because it's from your own blood. You can have swelling and bruising. That is mainly due to use of the needle. Typically, no side effects.
Talk to me about the horsepower treatment. What does that entail?
Okay, so it's a penile enlargement procedure. So it involves the use of a filler made from hyaluronic acid. And what this does, it basically attracts water and it plumps the area where you place it. So you can move from, get about an inch or two in width. Some people get length, but I have my own, formula. So if I want to lengthen it a bit, I know what to add, which I won't give it away. It's a secret. So I can actually add a bit more length as well as width.
How much more length?
On average, about 1 to 2 inch.
How often do patients come in for this kind of treatment?
To be honest, we have gotten a lot of inquiries about this treatment. It's quite an investment. The tubes are quite an investment. So, but you do have people coming in, those who can afford it.
Talk to me about the age group that you see coming in for this kind of treatment.
Late 30s to say 45.
And for horsepower pack, the cost is $100,000,
Yeah,
roughly.
around there.
And for the horsepower filler, what is the price range?
It depends on the type of filler that you select. Budget for at least 200,000. For the horsepower filler, you find younger patients in the 20s and early 30s. And for the horsepower pack, that's where you have the late 30s to about 45.
Talk to me about the stigma attached to the disease and why men should not let that intimidate them.
You know, the Jamaican population, we're known for sexual power and prowess, I would say. So can you imagine a young man in his community, not being able to, have an erection? So it can be quite of a shameful experience for him, especially, females talking among her friends, and, everything is on TikTok nowadays. So yeah, it can have negative effects.
Why shouldn't they be discouraged despite the stigma?
I mean, there's hope. We have many different types of treatments to address erectile dysfunction. So, just give me a call. I offer a comprehensive treatment plan. It involves examination, investigating, and treating with, procedures such as PRP, and put you on medication as well. And your lifestyle choices, very important. Stop the smoking, limit alcohol, get your rest, exercise, eat a healthy diet. So today we'll be demonstrating platelet-rich plasma. So basically we use platelet-rich plasma to treat erectile dysfunction. So let us start with what is erectile dysfunction. This is basically the inability to have or sustain an erection for sexual intercourse. So some of the causes of erectile dysfunction, we can group them. We have vascular, such as cardiovascular disease, hypertension, heart disease. Can also be due to uncontrolled diabetes, as well as high cholesterol. So any disease process that affects blood vessels or blood flow can cause erectile dysfunction. Also, some medications contribute to erectile dysfunction. You can have psychological reasons such as hypertension, diabetes, as well as other mental health disorders. Platelet-rich plasma is basically plasma that is concentrated. And how we concentrate it is with the use of this machine, right? So the first step is informed consent. So you want to explain to the patient what you're about to do. So it involves drawing the whole blood from the arm, right? And then we use specialized tubes which contain a gel, right, and an anticoagulant which prevents the blood from clotting. So what the gel is going to do, it's going to separate the blood into different components. So you have whole blood, right? So you have whole blood, which can be divided into red blood cells, white blood cells, and platelets. So what we're interested in is the platelets at the top. So you're going to put the tube in this machine. It's called a centrifuge, and it spins very quickly. And in doing so, it causes the different layers to be separated. So we do it for about 15 to 20 minutes, depending on the manufacturer's instructions, right? And the gel, as I said before, will separate the blood components. So after that now, I take the plasma, which is the top portion, right? And sometimes we do what we call a double spin. to concentrate the platelets. So in your blood, interestingly, you have growth factors and stem cells. So that's what we're trying to use to repair any damage that is found in the penis, right? So this banana here represents the penis. Can you see that? All right. So basically we start with we'll call a penile block. So we're going to use lidocaine to numb the penis so you don't have any pain, right? Then I use a tiny needle and I basically inject the concentrated platelets into different areas of the penis, right? So in about 3 to 6 weeks, you should start seeing improvements, start having morning erections, and slowly getting back into the groove of things, so to speak. It is, however, important to note that the patient must be investigated because you don't know what the cause of the erectile dysfunction is. So you want to assess the patient, do a physical examination, you want to do blood work, you want to screen for hypertension, high cholesterol, and so forth. Because like I said before, you can have many contributing factors. So those must be ruled out, and if you find that, they must be treated accordingly.
What inspired the name Horsepower Pack for this revolutionary medicine?
Okay, so horses are associated with endowment, so with strength and vigor and vitality. So I wanted to, I coined the term so that it basically rings a bell, it's easy to remember, and so far people are loving it.